Did you know that up to a third of people who have a mini stroke will have a major stroke within a year? That's a scary statistic, but here's the crucial part. Recognizing the mini stroke is your chance to prevent the big one. Today, we're going to talk about something incredibly important. How to recognize a transient ischemic attack, or TIA, often called a mini stroke, before it's too late. Sticking with me for the next few minutes could genuinely save your life or the life of someone you love. So what exactly is a mini stroke? Imagine the blood flow to your brain is like traffic on a busy highway. A major stroke is like a complete, long-lasting roadblock causing serious damage. A mini stroke, or TIA, is more like a temporary traffic jam. A blood clot briefly blocks an artery in the brain, but then it dissolves or moves, and blood flow is restored, usually within a few minutes to an hour. The problem is, because the symptoms are temporary, people often brush them off. They might think, "Oh, I just stood up too fast," or "I must be tired." But a TIA is a massive warning sign. It's your brain's emergency alarm, telling you that a major, potentially disabling stroke could be just around the corner. Ignoring it is like ignoring a fire alarm just because you don't see flames yet. The key to spotting a TIA is knowing the symptoms, and the easiest way to remember them is with the acronym FAST. Let's break it down. F stands for face. Ask the person to smile. Does one side of their face droop? It can be a very subtle change, like one corner of the mouth not lifting as high as the other, or one eyelid looking a bit lazy. You might notice their smile looks uneven or lopsided. This facial weakness is a classic sign that something is wrong with the brain's control over the facial muscles. A stands for arms. Ask the person to raise both arms straight out in front of them and hold them there for 10 seconds. If one arm drifts downward or they can't lift one arm at all, that's a major red flag. It's not about muscle soreness, it's about a sudden loss of control and strength on one side of the body, which points directly to a problem in the brain. S stands for speech. Can the person speak clearly? Ask them to repeat a simple sentence like, "The sky is blue today." Are their words slurred? Are they using the wrong words or having trouble understanding what you're saying? Any sudden difficulty with language, whether it's speaking or understanding, is a critical warning sign. It might sound like they've suddenly had too much to drink, even if they haven't touched a drop of alcohol. And finally, T stands for time. This is the most important part. If you see any of these signs, facial drooping, arm weakness, or speech difficulty, it is time to call emergency services immediately. Right away. Don't wait to see if the symptoms go away. Every single second counts. The person needs urgent medical attention, even if they start to feel better. Remember, the symptoms of a TIA are identical to a stroke. The only difference is that they're temporary. You can't tell if it's a TIA or a full-blown stroke while it's happening, so you must treat it as an emergency every single time. While FAST covers the most common signs, there are other symptoms you should be aware of. These can also appear suddenly and without warning. One is a sudden, severe headache. We all get headaches, but a stroke headache is different. People often describe it as the worst headache of my life. It comes on like a thunderclap with maximum intensity in seconds. There's no gradual buildup. If you or someone else experiences a sudden, excruciating headache, especially with other symptoms, it's an emergency. Another symptom is sudden vision problems. This could be blurred or double vision, or even a complete loss of sight in one or both eyes. It might feel like a curtain is being pulled down over your field of vision. It's not just about needing new glasses. It's a sudden, dramatic change in your ability to see. You might also experience sudden trouble with balance or coordination. This isn't just feeling a little clumsy. It's a sudden inability to walk straight, feeling dizzy, or a loss of coordination that makes simple tasks like picking up a cup impossible. You might stumble or feel like the room is spinning. Finally, sudden numbness or weakness is a key sign. We already talked about it in the face and arms with FAST, but it can happen anywhere on one side of the body. You might feel a sudden pins and needles sensation or complete numbness in your leg, arm, or one side of your torso. Again, the key word here is sudden. The tricky thing about a TIA is that the symptoms can resolve completely, sometimes in just a few minutes. The person might feel totally normal afterward and think they're fine. They might even try to convince you and themselves that it was nothing. This is the most dangerous moment. Feeling better doesn't mean the danger has passed. It means you've been given a window of opportunity to act. So, what should you do? If you suspect someone is having a TIA or a stroke, call 911 or your local emergency number immediately. Don't drive them to the hospital yourself. Paramedics can start life-saving assessments and treatment on the way. While waiting for help, keep the person calm and comfortable. Note the time the first symptom appeared, as this is crucial information for the doctors. Once at the hospital, medical professionals will run tests like a CT scan or an MRI to see what's happening in the brain. They'll work to identify the cause of the TIA, which is often related to conditions like high blood pressure, high cholesterol, atrial fibrillation, which is an irregular heartbeat, or diabetes. Treating the underlying cause is how you prevent a major stroke. This might involve medications to control blood pressure, thin the blood, or lower cholesterol. It might also mean making important lifestyle changes. This is the gift of a TIA. It alerts you to these problems before they cause permanent brain damage. Let's talk about those lifestyle changes, because they are powerful. A healthy diet, low in sodium and saturated fats, can make a huge difference. Regular physical activity, even just a 30-minute walk most days of the week, helps control your weight and blood pressure. If you smoke, quitting is one of the single best things you can do for your vascular health. And managing stress is also incredibly important. It's vital to know that anyone can have a TIA, but certain factors increase your risk. Age is one. The risk goes up as we get older. A family history of stroke also plays a role. And as I mentioned, conditions like high blood pressure, diabetes, high cholesterol, and heart disease are major risk factors. But the good news is many of these are manageable. So let's recap the most important takeaways. A mini stroke, or TIA, has the same symptoms as a major stroke, but they are temporary. The acronym FAST, face, arms, speech, time, is your best tool for spotting the signs. If you see any of these signs, even if they disappear, it's time to call for emergency help immediately. A TIA is a critical warning. It's a chance to get medical care and make changes that can prevent a devastating, life-altering stroke. Please share this information with your family and friends. Knowing these signs could empower you to act quickly and save a life. It's not about creating fear, it's about creating awareness and readiness. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more important health content. Stay safe, stay aware, and take care of each other.